Hi guys, welcome to the new session. In this video, we will talk about dynamic of disease transmission, that is reservoir. Myself, Dr. Tushar Kalra, MD, third year PG resident in Community Medicine Department. Let's start, guys. So, what is a reservoir? So, a causative organism lives, multiplies, and depends primarily for its survival in reservoir. So, reservoir can be of two types. That is the homologous reservoir or an heterologous reservoir. In homologous reservoir, both the reservoir and susceptible person belong to the same species. For example, chickenpox or measles, so they have human to human transmission. So reservoir and susceptible person are same, that is human. In heterologous reservoir, both the reservoir and susceptible person belongs to different species, that is, for example, rabies, dog or human, salmonellosis, cattle and human. Okay, so in rabies, dog is a reservoir, human is a susceptible person. Next is we have to know the difference between source and reservoir. So, what is the source of infection? Source of infection is a person, animal, arthropod, soil, or the substance from which the organism is disseminated directly to the host. They are not synonymous words, so they are different words. Source means immediate source of infection. Okay, it may or may not be a part of a reservoir. Okay, then types of reservoir. It can be a human reservoir, animal reservoir, or soil reservoir. In human reservoir, it can be either a case or a carrier. So first we will look into the case. What is a case? A case is an infected person having clinical feature of the disease. It may cause a mild, moderate or severe case. We know that mild cases are more dangerous than the severe case because they are ambulatory and they keep spreading the disease. The subclinical case, which is also known as apparent, covert, missed or abortive cases, they are important as they silently spread the disease because they multiply in the host but does not manifest itself by signs and symptoms. Cases acts as a source during the period of communicability. Okay, so cases that mild cases and subclinical cases are very much dangerous than the moderate and the severe cases. So this is a definition of some definitions, that is primary case, index case, secondary case. So primary case is a first person developing the disease in the outbreak in the defined population. Index case is the first case which comes to the attention of the investigator. And secondary case are those cases which gets the disease by contact from the primary cases. So we have to know the difference between primary case and an index case. Now carrier. So human reservoir can be a case, can be a carrier. So a carrier, it is an infected person but not having the clinical feature of the disease and serve as a source of infection to others in the community. Okay, and it can be demonstrated by laboratory investigation. Carrier constitute the submerged portion of the ice in the iceberg phenomenon. Now types of carrier. Types of carrier, first is according to the stage in disease cycle. There are three types: incubatory carrier, convalescent carrier, healthy or contact carrier. Incubatory carrier, they spread the disease spread occur during the incubation period. Examples: measles and mumps. Convalescent carrier is a carrier during the period of recovery from an illness, during which clinical cure is observed but not the bacteriological cure. Example: typhoid fever and diphtheria. Third is healthy or contact carrier. These are the subclinical cases which acts as a source of infection to others. For example, the nursing staff, the patient attendants who are in close contact with the case, they can become a healthy carriers. Example: cholera and diphtheria. Now, classification of carrier. Second, according to a duration of carrier, it is temporary and chronic carrier. Temporary carrier, they spread the disease for a short period of time. Example, all incubatory, convalescent, and healthy carriers are temporary carriers. Then chronic carriers, they transmit the disease for a long period of time, mainly weeks to months. For example, tonsils in diphtheria and liver in hepatitis B. Third is according to the route of exit of the organism. They are urinary carrier, intestinal carrier, biliary carrier, cutaneous, nasal carrier, and genital carrier. Animal reservoir. Animal acts as a reservoir and transmit the disease in human. So the disease that they transmit is called as zoonotic disease. So here is a table of animal reservoir and disease they transmit. So cattle, for example, cattle transmit bovine TB, salmonellosis, tetanus, brucellosis. Horse, tetanus, dog, rabies and hydatid disease. Monkey, yellow fever, Kaizen forest disease, dengue fever. Sheep, anthrax, liver fluke. Pig, Japanese encephalitis, Taenia solium. Rodents, plague, leptospirosis, endemic typhus. Birds, leukocytosis, histopulmonosis, and ornithosis. Now last is soil reservoir. So soil acts as a both reservoir and a source of infection. It transmits a disease like tetanus, gangrene, anthrax, and aspergillosis, etc. So these are the references. So like, share, subscribe, and thank you.